Our research topic was the effects of opioids on the Medicaid system. We will present to you how Medicaid is affected by opioid misuse and what types of programs should be implemented by pharmacies to decrease the cost and benefit Medicaid. This presentation is given by Caitlin Humph and Rebecca Ludwig.
In the United States, there were over 259 million opioid prescriptions written in 2012 alone. This is almost enough prescriptions to give one prescription to each person in the United States. Not only do these opioid prescriptions have a cost to Medicaid and their patients, but also have a financial burden to society as well. In 2014, almost 20,000 patients died from accidental opioid overdoses, with about 75% of these patients being Medicaid enrollees. Due to the misuse of opioids, it has also clogged up our emergency departments and resulted in a nearly 500,000 emergency department visits, which accounts for 29% of all emergency department visits.
Pharmacies need to ensure they are using the necessary precautions for identifying opioid prescription abusers. Random insurance audits make sure pharmacies are correctly dispensing opioids to patients at all times throughout the year. Pharmacy programs such as Enterprise allow pharmacies to know when it is too soon to dispense medication to a patient as well. Since opioids are controlled 2 substances and have a higher risk of being stolen, pharmacies keep opioids in a locked storage area. In the future, using an opioid overdose risk calculator may be useful for pharmacists in knowing which patients are at a higher risk of misusing opioids so they can properly dispense opioid antagonists such as naloxone.
There are more precautions in a pharmacy with dispensing opioid prescriptions for cash due to loopholes that could be surpassed by an addicted patient. These additional steps include extra paperwork that is needed to be filled out by the pharmacist ensuring the prescription is being filled within an appropriate vicinity from the patient's home location, the patient has appropriate insurance such as Medicaid, and the patient is not pharmacy shopping and abusing their prescribed opioids. Pharmacists must also keep an extra eye on the patients using opioids to make sure they are taking the medication properly and they are not at a high risk of overdosing on their opioid medication. The pharmacy staff must take extra precautions when dispensing the opioid medication to family members due to the high restrictions and penalties that come from opioid misuse.
Over the last several years, there have been changes to the law when it comes to opioid prescriptions. There is a PDMP database now for controlled substances, which tracks where and when the patient has picked up their controlled medication for several years. If the patient is on a state program, however, they are not allowed to pay cash for their prescriptions. The patient must run their prescription through their state aid insurance before the prescription can be dispensed by the pharmacy. The most recent law change, however, is with opioid antagonists. In Wisconsin, specifically, a pharmacist can now dispense naloxone without a prescription to anyone who is or knows of someone at risk for an opioid overdose.
The benefits of having more opioid programs decreases the number of patients who are addicted to opioids, along with those who may overdose from opioid prescriptions. This, in turn, will decrease the cost of the patient on the Medicaid system and will allow more money to be spent on other patients, other healthcare costs, and possibly fund more research for new treatments. These are additional resources you can look at for your enjoyment.